A new therapeutic diversion program is going to give people experiencing a mental health crisis an alternative to going to jail. KVUE's Jessica Cha was at the program's launch party earlier today, and Jessica's here now to explain what this program is looking to achieve. Jessica?
Well, Brian, city and county leaders are trying to create a new standard when it comes to mental health. They say that it can be hard in times of crisis to get someone the right kind of treatment and the right kind of help. But the people who created this program say that jail shouldn't be the only option. And so Integral Care is offering a different one. This is the first step to breaking a cycle.
The therapeutic diversion program has multiple components, a place to go and a place to stay.
Integral Care has launched a program that offers compassionate treatment to those experiencing a mental health crisis, because often the only place to get that help is jail.
We've got about 2,500 people in the jail today, and depending how you measure it, 40 to by some people's opinion, 70% of the people in there would not be in jail if they didn't have an unmet mental health needs. DeAndre
Gardner says this program is long overdue. He's a peer support specialist at Integral Care, but was also homeless for 2 years. He says resources for people exist, but are extremely limited.
There's like a cap to it, and then there's days and there's time, so it's very difficult to access services.
Gardner says one's trauma, mental health problems, and harsh living conditions can largely affect behavior.
It's very easy for, an individual who's unhoused and has struggling with mental illness to be put in a situation where they get, incarcerated.
Travis County Jail's Director of Inmate Health, Daniel Smith, says they treat over 900 people experiencing mental health problems in their facility.
We could probably close a few units if we were able to get them into the right treatment and care.
He says it's not uncommon for folks experiencing a mental health crisis to cycle in and out of jail up to 10 times a year. And jail is not a place to get better.
Now I have a place where I can take them and drop them off and know that they're going to be able to get the medical care, the mental health care, and housing that they need.
The diversion program works in 2 parts. First, folks with nonviolent misdemeanor charges can be referred to Psychiatric Emergency Services, or PES, at their 24/7 walk-in urgent care facility.
And we are expanding the clinical team to include medical professionals, additional medical professionals, and added 23-hour observation service.
If they need more in-depth care, there's a 25-bed facility people can stay up to 90 days where there's therapy, medication, and help finding permanent housing. Trying to break the cycle.
Investing in care rather than incarceration not only uplifts those in crisis, but it also makes our entire community safer.
Now, this isn't the only kind of diversion program around. Travis County already offers a program like it at the Herman Center, where they divert people from emergency rooms and offer them short-term psychiatric crisis care. Live in Austin, Jessica Cha, KVUE News.